Hey guys! Today's guest is someone who has operated at the highest levels of our healthcare system and is now helping people better understand how to navigate it. I am so excited. Dr. Terry Adirim. I wanted to make sure I got her name right. Dr. Terry Adirim is a physician, healthcare executive, and national leader who has spent decades shaping how healthcare is delivered at scale, from clinical care to public policy to digital transformation. She has served in executive leadership roles across some of the largest and most complex healthcare systems in the country, including as acting Assistant Secretary of Defense for Health Affairs, where she helped oversee care for nearly 10 million people, and as a leader in the Department of Veteran Affairs, driving large-scale healthcare modernization. Modernization. Hello. But what makes her work especially important right now is her focus on the patient and helping everyday people better understand and navigate a system that can often feel overwhelming and confusing. She's also the author of the upcoming book, The Prepared Patient, Your Guide to Surviving the Healthcare System. And don't we know that? We need that, which is all about giving people the tools to take control of their own healthcare experience. Dr. Adirim, I am so excited to have you here. Welcome to the show.
Thank you for having me. I'm very excited to be here. I love your podcast. It's so needed in this day and age. So thank
Oh
you
my
for that.
gosh, I am so excited to have you here because I just feel like this conversation is so necessary. We talk about so many things on this podcast that are relevant to women, but in general, just the extreme overload of how do I navigate this current system, especially when prices are going way up, people are paying so much more, services are going down. It's overwhelming. So I'm super excited to have you here. Before we get into all the tons of amazing things that you're doing and all the fabulous things, I always like to start with who you were before your career and everything you've built. So, who were you growing up, and what was younger Terry like?
Yeah, gee, I'm gonna have to go really far back to think about that. No, I'm kidding. I think growing up, I was always very curious, very much about justice and fairness and helping people. And one of the ways, even from a very young age, that I thought I could do this would be being a doctor. I remember a few things that are kind of amusing to me. One of them was when I was about 4 years old. I had a birthday party, and my mother kept insisting that I wear the cap for the nurse. And I kept saying, no, I'm going to be a doctor. So that thought came into my head. And the funny thing about it is that, it's like, why would I say that? And, what part of why do I want to be a doctor? And that kind of persisted. Even my first book I ever bought, I got money at one of these book fairs. I was like in first grade, and I bought a book called The Human Body. Scientific American, The Human Body. I can't believe I remember that. So I've always been interested in medicine and healthcare. Even when I didn't know anything about it, I always had that curiosity.
I
Thank you
l-
for that. I remember.
I love the visual of your mom giving you the nurse's cap and you're like, "No, no, no. I'm going to be the doctor." I This makes my heart so warm. That is so cute. And I'm
Not
sure your
so
mom.
proud about being a nurse because nurses are.
Exactly. Exactly, but I love that you had the personal insight to know, like, "Oh no. Oh no, mom. I'm going to be the doctor." I love this so much, and your mom was probably like, "Oh boy, here we go. Here we go. My little doctor." That's so cute. Oh, I love this story. Okay, so you've had this incredible career across clinical care, policy, and leadership at a national level. What originally drew you into medicine outside of this lovely little story you just told us? But what originally drew you into medicine? And did you ever imagine your career would evolve the way that it has?
Um, yes and no. So, I think like many women, I've had a number of career pivots. There's all kinds of reasons why I call out women for this, because I think there's always challenges to whatever career that you choose. But for me, I have known from a very early stage in my career that I wanted to do more than just the one-on-one taking care of patients. And I knew that it had to start there. I was always interested actually in every specialty. When I was in medical school, I was very excited going through my clinical rotations. But it was probably during third year medical school where I realized that physicians can make an impact more than just that one on one with the patient, but with populations of patients. And I did something unusual for the time and went to public health school between third and fourth year medical school. I think people thought I was crazy. But I thought it was a really good time for me to help me understand where I could take my career, and it was the best experience. I went to the Harvard School of Public Health, the number one public health school, and met so many great people and mentors that really changed the trajectory of my career. I went into medical school thinking I was going to be possibly a surgeon, but then realized amongst the most vulnerable populations were children. So that changed my trajectory into pediatrics. And I became a pediatrician and a pediatric emergency physician. So that 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 to me was monumental. And even as I finished my training in pediatric emergency medicine and became an attending physician at a children's hospital, I was gravitating towards those type of projects and research that helped communities and populations of patients.
Mm. I love that. Many, many years ago, I was a volunteer at Children's here in Denver. And just the amount of love that those doctors and nurses, and that's a testament to you and the work that you've done, just is so impressive. And just it's hard taking care of those little guys and girls like that. That's just they're such delicate little creatures, and especially in a scary
Easy,
hospital. Well,
easy.
yes, I mean, I'm sure probably a lot better as a patient than us big grown complaining adults.
Yes, there's truth to that. Children are pretty resilient, and you just can't do enough for them. I love little kids.
Oh, so sweet. You've seen the healthcare system from the inside at the highest levels. What is something most people don't realize about how the healthcare system actually works?
Yeah, that is a really terrific question. I think one of the things that I think about is that people assume that the healthcare system is this one coordinated system, that it's even a system. It really isn't. It's this fragmented set of health systems and institutions and practitioners, and it's all separate systems that most of the time don't communicate very well. One example comes to mind when I was working in the pediatric emergency department. I was taking care of a family that was transferred from another hospital to our children's hospital. And as I was asking the family the history and, asking about tests that were done, the father said to me, pointing to my computer, "Isn't it all in that box over there? Isn't it all in that thing over there?" And I had to chuckle and I had to say, well, it should be, you're right, but it's not. You came from a different health system, so that information isn't here. And I apologize, I have to ask all the same questions again. I think patients go through that every time they go from one practitioner to another. Why do I have to keep repeating myself? And there's all kinds of reasons why, but one of them is that it doesn't necessarily transfer. So your doctor may not know what another doctor prescribes, may not know what other tests were done, and things like that. So, the other assumption is that there's one person taking care of all of your needs, and that is not necessarily true. And I talk about this in my book. Thank you for mentioning it at the top. That, patients, because of all this fragmentation, patients really need to be their own advocate and they need to be prepared to be a full partner with their physician and with the healthcare system. So being prepared, knowing your information, knowing your diagnoses, your medications and doses and family history, and all of that is really key to ensuring that that you have as good a chance as you can to having a good outcome. So what I would leave with, bottom line, the health care system is not really a system. It's not one system. It's a maze of systems, and patients really could use a map, and they could really help themselves by being empowered to know all of their information.
Yeah, I think that's a really good point that you made about several good points, but that there's no one practitioner. So if you have some odd thing or you need to see a specialist, you do have to go to your primary and that they have to refer you to whomever. And I think that for a lot of patients, they're like, why can't I just go to whoever and get taken care of? So I think that's a great point, but also that things aren't connected and you are going to have to repeat yourself and you are, which is super frustrating because if you've been a bunch, you're like, oh my gosh, here we go again. Like speed dating doctors, right? Like you're like, oh, here's the. And the other thing is just like being your own advocate is so important because I think also people think, well, they're a doctor, they're going to take care of me. And the thing that I think a lot of people don't think of is, they're seeing so many patients in a day. If you don't call out these extreme experiences you're having and or you're, be your own advocate, it can easily get missed or skipped. And so I think sometimes we're like, oh, I don't want to say that. It should be in my file. Like, why do I have to? No, you have to say it. You have to speak up because, what is it? The squeaky wheel gets the grease.
Sure. And I think you're 100% right. And I would add to what you're saying that a lot of times patients feel vulnerable. So they don't speak up because they're concerned for all kinds of reasons. They may feel that their physician thinks they're not smart, or that they're being a pain, or that they're being a squeaky wheel and their doctor won't treat them in a certain way. And none of that is true. I will say, as a physician, I've always appreciated when patients come in with information that they know more than I do about themselves, and I think that's really important. And physicians really appreciate when patients come armed with that information. I think I have to underscore that, especially in situations where patients are in the emergency department or inpatient, they do feel very vulnerable. They're frightened. They can be overwhelmed. So that's why am an evangelist for being prepared before you need all of that information. I think, too, your point about physicians seeing a lot of patients in a day is spot on. I think our system pressures physicians to see patients in blocks of 15 minutes, which is not enough. And more than once, I've heard my colleagues say, well, they have to come in, they can only have one problem because we can't go through their whole problem list. And most patients have more than one problem. So that's why I advocate for not only being prepared, but especially in situations where you feel vulnerable, like the emergency department and inpatient setting, is to bring somebody with you that could help you advocate. Because, we've all been patients, and I understand that feeling of, I better, be nice, better behave. Though I will say I'm not the most well-behaved patient, uh, but I think being prepared could really help in those situations. So thank you for making those points.
Yeah, I love that additional advice of being prepared because I don't think oftentimes when we're going to the doctor, we're not prepared. And so I think just having that idea in our mind as we head into a doctor's office, like, okay, she said be prepared. I need to be prepared. I need to bring all the big guns out at first so that your doctor can evaluate it quickly and hopefully give you better care.
Right.
One thing you've said that really stood out to me is that even capable people struggle to navigate healthcare and that it's not a personal failure. And I love that so much because I think so many people are like, ugh, they get overwhelmed with the apps. They get overwhelmed with, I didn't know I needed this or that. So why is it so difficult for patients to navigate the system today?
Yeah, I think that gets back to the fact that it's a fragmented system. It is so complex. I mean, the complexity overwhelms people no matter what your education level or how intelligent you are. It is super difficult to navigate. I mean, just think about how complex health plans are and our insurance. I mean, I'm reminded of several months ago, my daughter, a very smart law school graduate, came to me and said, my doctor's asking me, she's holding her card, my doctor's asking me about my ID number and this thing here. I don't know. Could you tell me? She handed it to me. Could you tell me what this is? And I realized I had to include in my book a picture of that with identifying what each thing means. And I think a lot of people don't know the difference between a deductible and co-insurance and out of network and all of these phrases. We've made the system so complex that it's just not usable anymore. So I think that probably gets to the nub of it, that if people who are highly educated are having difficulty navigating the system, then most people are having this difficulty. I will say, I do have to add, because in my book, especially in the introduction, I talk about the patients that I took care of in the pediatric emergency department, where the parents of children with special healthcare needs or medically complex children. And they were pretty uniformly prepared. I called them the white binder parents. They came, these big fat white binders, with all of their kids' information, which, believe me, greatly appreciated. So they're a great example of being prepared, really could help facilitate care and give you the best shot at having a really good outcome.
I love that you put a picture in your book and kind of just walk through the basics, because I think like so often it's just like, oh yeah, that's your copay. Oh, that's your deductible. And it's like, I'm sick and I don't even know what you're talking about. And I am like, what does this little card mean? What are all these things? So I love it that you basically start at the beginning and say, whoa, let's time out here and let's just walk through what are the basics here. Let's help you understand from just a basic idea or sense as far as where you're even beginning from, because I think that is really it's a combination of overwhelm with all the things, and when you put somebody sick on top of that or struggling with something, it makes it that much worse. So I love that you start there, and let's start there, and then we can get deeper into all the tricky stuff.
Right, but think
um
about this. When you talk about basics, it's not basic. I mean, it's complex. And when, the figure that gets thrown around is that only 12% of people in this country are fully health literate. That's pretty sad because, 88% of the population isn't simple or uneducated. So
right.
even the basics are complex. So yeah, that's our system. So.
Wow. Well, you in your book, which by the way, again, it's called The Prepared Patient, which I love because it feels very empowering. You talk about what it actually means to be a prepared patient. Like you said, the white binder parents. I love that so much. I love the visual. How does that change someone's experience, for example, the white binder parent to somebody that's just like coming in all disheveled and a mess, like I don't know what's happening.
Right. Well, the white binder parents, the parents of children with special health care needs, are very empowered advocates for their children. And I think that's the lesson that I'm trying to portray in the book, is that you too can be empowered and advocate for yourself and your family. So a prepared patient is a patient that is informed, organized, and engaged in their care. You're fully a partner with your physician. I mean, it means so much to you and your family that you get the best outcome that you can get. And you do this with knowledge and empowerment. So those are the messages that I'm trying to convey.
And I think it does significantly change your experience, if one versus the other, because if you are working hand in hand with your doctor and you're more prepared, they're going to be more mentally available. Now, I know that's like sounds ridiculous because I've scheduled time with you. I'm coming in, you're my doctor. But just like you mentioned earlier, there's blocks of time and, we've got to get through this and that. And I think everybody understands that has a schedule and works. However, you don't want to feel like that when you're coming to the doctor. So that makes sense why that would significantly change your experience and what you're experiencing with whatever doctor you're seeing, whether it's your PCP or whether it's a specialized doctor.
Right, right. And I will say, speaking as an emergency physician, where it's even more important to be prepared because you only have a couple minutes with the doctor. I hate to say that, but most emergency departments are overwhelmed and patients come in crisis. And the patients that are seen first are those who are in the worst crises, right? Those that are in conditions for which, they could die very soon. So you have just a couple of minutes to state your problem and ask your questions, right? So being prepared beforehand really helps you ask the right questions, ask for clarification. And so, but you really want to do that before you hit that crisis. And as you say, it's also important when you have only that 15-minute block to talk to your primary care physician about what issues are important to you. So those are the
Um,
messages I'm trying to convey. So,
yeah, as someone, if someone's listening right now and they are feeling just overwhelmed by the healthcare system, what are a few things that they can start doing immediately to better advocate for themselves? Are there any like tips or tricks that you recommend that they can do actively themselves to feel like they're taking back control of what's going on?
yes, and there's a couple of things that patients can do right from the start. I go through lists, I have checklists in the book um, of things that patients can do based on the topic. But two top things that they can do is one, understand their coverage. That is vitally important because I think many patients get blindsided by prior authorizations. What are prior authorizations? Well, your doctor may prescribe a medication, which is an expensive medication, and they need to ask your insurance company for permission for them to cover that. So understanding that process and understanding what medications, for example, are on the formulary. So that is discussed in my book, but understanding what your insurance covers is vitally important. Is your physician within network or out of network? Because that has financial implications for you. So understanding your healthcare coverage is important. Now, it may be health insurance if you're employed. If you're not employed or self-employed, understanding what your options are outside of the employment-based or employer-based insurance, whether it's through the marketplaces or private plans versus high deductible plans or no plans at all. You need to understand the pros and cons and impact. The second thing that you can do is make sure that you write down what your medical conditions are, your medications and dosages, what are your allergies, any surgeries or major hospitalizations that you've had, who your doctors are, your pharmacies, because when you go to a new physician, they always ask, well, what pharmacy do you go to? Have that telephone number, emergency contacts, and also your insurance information. You always get asked wherever you go, the first thing they ask for is your insurance card. So always make sure you have that information handy.
I think that's a really great point because, I am someone that has had health struggles in my life, and I have a lot of allergies to medicines specifically. And so I carry around my allergy list because it is deep, and also because, um, you know, having access to that and assuming that they may not, to your point earlier, of the systems may not be connecting, may not be talking to each other. The last thing that you want to do is have some kind of massive health problem because you didn't have your list with you and they didn't know because the system wasn't working or wasn't tied together when you went in. So I think having some of these bits of information handy and at the ready outside of just your insurance card is really important, and I think, it may sound kind of cheesy or nerdy, but I have my little list and I keep it in my wallet, and I have it accessible. You don't have to carry a 3-ring binder, but just having some of this really important information at the ready so that you aren't given something that you have a huge reaction to, that would be terrible, right? So just some of this basic information at your fingertips, if it's going to make a big difference, obviously you don't have to, give them all of the information of every day of your life, but having some of those really important pieces handy
Right.
makes a lot of
No, and
sense.
that's a really great point because you probably, it sounds like you have a list, and it's not just one or two allergies. So, something could fall off. It's hard to remember because in your day-to-day life, you're doing all kinds of things and you may not have that. And so, what I've tried to do and what I am doing is I've created a website. It's thepreparedpatient.com where I'm going to create a book. And actually, I created this booklet, which I plan to do electronically. See the prepared patient, which prompts you to write down all of this information. And on this website will be this booklet that you could create for yourself, that would have all of this information. It's just a way to organize your information. And some people may not need something that complex, maybe just like what you've done, just kind of a list. But for more than 50% of people in this country that have a chronic medical condition, having a more extensive kind of place to keep that information, I think, is
I
important.
I I love that. I love having a digital, like just a digital notebook, a digital 3-ring binder, if you will, that you
Right.
have easy access to. Because like for example, with medications, okay, so let's say I am patient B and I have 20 allergies to different medications. My guess is if you had to spell any of those, you would be in a bad way. So even just remembering the names, like, I just say, I don't remember. Here's the list, like it's all of them, like, but understanding what those are and how they affect you, a doctor can look at one of those lists very quickly. While it may mean nothing to you, you think it's medicine, right? A doctor may look at that and go, oh my gosh, well, thank goodness I have this list because now I know. So I love the idea of the digital card that you're building, that you can just keep this data super handy and share it easily instead of, like, I'm 100 years old carrying my list around.
Right. And we're getting to a point, I think, within our system, non-system, where exchanging information is going to become easier and easier. We are going to get to a place where that information is going to be able to flow better than it is now. We're sort of in this transition period. But even having this information as a backup, I think, will still be vitally important, even if that information does flow. And this happens to all of us. I had a primary care appointment yesterday, and I'm a hot shot. I know I don't have a lot of issues, but I had my issues, and one of them, I said, yeah, I had lab work done. My GYN did lab work a couple months ago, and she said to me, "Oh, I don't see here at TSH you get that done every year. Is there a reason why?" I'm like, "Oh, I meant to tell you I have a family history of thyroid disease. It's supposed to be done every year." So even myself as a physician who is fully
Right.
cognizant of all of this, I'm like, "Oops, sorry, yeah, I forgot. Thank you for for picking up on that." So, I think no matter, again, I want to emphasize this is not about intelligence, this isn't about education. This is about making sure that all the things that you need to have done for you to improve your outcomes, is important. This, being prepared and all of that. So,
I love that. I love that. Even, you're saying, "Oh, I came in. I'm a hotshot doctor. I've come in and I know what I'm doing. I tell people about this all the time. I wrote a book about it." And even you were like, "Oh gosh, I forgot to tell you about that." So I think it makes it just so relatable for the everyday person to go, okay, like, even she is like, forgot to tell something. So having that information handy is so important. And I have a question about, from what you said about the system, where you feel like it's getting better. I feel like when we went through COVID, the systems got exponentially better because they had to, as far as just connecting the dots for people and connecting information, because we weren't going in and we weren't using paper records as much, and we were forcing the digital transformation. But do you feel like there was that significant shift? Do you feel like there is another significant shift coming where we are going to be having more tightly tied records, where people can go from California to Florida to Maine and have some kind of consistency? Is that a crazy dream?
No, it's not a crazy dream, and it was the dream of a law in 2009 called high tech, um, where information was supposed to be flowing through electronic health records, where there would be health information exchanges, which do exist. So information does flow, but then, as with everything else, it's not that simple, sharing information, right? We have electronic health records, which are proprietary systems. So most of the healthcare systems in this country use one EHR Epic. It's a proprietary system. So it's taken a number of years to kind of get to a place where there could be that sharing of information. But I am hopeful. I think we're going to get to a place where that will be shared freely. I had the good fortune to work on the Department of Veterans Affairs EHR modernization effort. And the overarching goal was to make sure that service members, when they leave military service, their records at the Department of Defense would be able to flow unhindered directly to the Department of Veterans Affairs. And that meant having the same exact instance of electronic health record in the many different hospitals and clinics at DoD with the Department of Veterans Affairs, which has over 1,200 healthcare facilities. Now, we're not going to get to that nirvana within the private sector healthcare system, but that is something that people in healthcare really, really, really want. And so I do feel like we're going to get to that place. I think what is going to transform our healthcare system now, I think you're kind of driving to this, is the potential of AI to improve a number of these things. I think a lot of physicians believe that the EHR implementation, though a necessary thing, was a bit of a failure in that it's created a lot of barriers between physician and patients. I mean, we used to complain all the time, and we still do, about having to type while talking to patients, right? And I'm sure patients didn't like it, like, hello, I'm here, look at me. And I think AI has that potential, and it's starting to ameliorate that particular issue through AI ambient scribes, meaning that the conversation between patient and doctor gets recorded so that it's organized into a note so that you don't have to be a transcriber typing a note. It may, and studies are showing that it's saving time and reducing burden on the physicians, but it hasn't spread everywhere yet. So that's one transformational item and thing that will help. It also helps too, because I know I went a couple years ago, I had to look through my mother's medical records, and she had like 3 or 4 hospitalizations, and it was like seriously 3,000 pages, most of it garbage, right? So having to go through that, can you imagine? And I do know, as a physician, having to go through like all those useless pages. Well, AI now can do summaries, so you don't have to go through all those pages. So I think we're entering an era of promise. But we have to be careful that there's not too much hype. There's all this hype when AI is going to replace doctors. No, they're not. It's going to replace all of these functions. No, it's not. So I'm hopeful. I'm hopeful.
Thank you so much for being here. I hope you love this conversation as much as I did. And we're not done yet. This continues in part 2, so make sure you come back and join us there. That's a wrap on today's episode of Carrie, It's Not That Serious. If this conversation resonated, subscribe and share it with a whip, a woman in power in your life. You can find more conversations, more community, and all the fun INTS merch you love at itsnotthatserious.com. We're building something meaningful here, and I'm so glad you're a part of it. Until next time, remember, it's not that serious.